Hey, it's Michael DiDomenico with Surfing the Sleep World. Michael D. My guest today is Amir Reuveny. He's the CEO and founder of Wesper. He spent his childhood watching his father snore, gasp, and crash after dinner. The family chalked it up to exhaustion. It was almost certainly 2 decades of undiagnosed sleep apnea. Amir holds a PhD in electrical engineering from the University of Tokyo, where his research on electronics, thin and flexible enough to conform to the skin, was published in Nature and Advanced Materials. Amir, thanks for being here.
Thanks so much, Michael, for having me. I'm really excited to be here today.
Thanks, Amir. So for the people that don't know, I don't know how they couldn't, but tell us what Wesper is and what problem you're solving.
Great. So Wesper, we're building a sleep diagnostic and management ecosystem that empowers healthcare provider with reliable, high-resolution data to streamline workflows and also enhance outcomes. All this while keeping patient experience extremely easy, engaging, and comfortable. Our flagship product, which people might be more familiar with, is an FDA-cleared home sleep test solution that provides physicians with the same respiratory signals they are trained to read from a sleep lab without requiring the patient to come in or deal with very cumbersome equipment in the home environment. I'm talking about these two small wireless patches that are very comfortable and easy on the skin, and provide more than 95% correlation to in-lab polysomnography. The last thing I will note is that the platform will support multi-night testing that extend into treatment management, including therapy titration and ongoing monitoring. So this is Wesper in a nutshell.
Yeah, I mean, longitudinal testing is really kind of all the rage and should be, so you can get multiple night recordings and really get a good reading on what's happening instead of one night snapshot. Has that always been the focus of Wesper?
Yeah, since the beginning, we launched the platform with the ability to support multi-night, so people can look at a more comprehensive diagnostic decision point where you have multi-night and night-to-night variability. But also we understand from the get-go the need in outcome management. Sleep medicine for many, many years was confined to the lab, which made it very difficult, one, to diagnose, created a huge bottleneck and a very large health epidemic on sleep. But also there was no ability to measure outcome over time, which is a big gap. So Wesper was initiated and was born with the concept of one night test is not enough, and you need multi-night testing to better diagnose, but also better manage the patient over time.
I always like to know where the names of companies come from. And where did the name Wesper come from?
So Wesper is actually a combination of Vesper, which is a night prayer, and Whisper, which gives a very nightly and calming environment for the product and the company.
That's good. I like that. I like how you guys have really leaned into it. It's almost like a lifestyle brand. Your marketing is very almost like fitness oriented and a very different tack from a lot of other HSTs and things that you see.
Right.
Obviously that positioning was intentional.
Right. And I think it comes from, first of all, I would say my passion to design and ease of use and approachability. The Wesper brand was built around a tone of voice that is very approachable. It is, smart, but also accessible and easy to understand. And this was something that was very important for me from the get-go, understanding that awareness is a gap in sleep medicine, but also getting insight into something that is a mystery for you. You're going to sleep and you don't know what's happening. You need better tools in order to communicate it to the patient. And so having the brand, speak to the layperson and to everyone equally was very important for us. And this is how the brand was built from the get-go.
The therapeutic landscape is really moving toward mechanism-based care. Where do you see the diagnostics? Where do they need to go as opposed to where they are today?
So I think right now the diagnostic infrastructure is still is already strained. Like sleep medicine is one of the most understaffed specialties in the country, with significant technician shortage and very long times for in-lab studies and even for at-home studies. Um, At-home testing provides much more capacity for sleep physician and also other professional, but still some of the home sleep tests infer events from secondary signals like heart rate, SpO2, which provides insightful and important information, but many times doesn't get to the mechanism of the sleep disorders. I think when CPAP used to be the only treatment available, this level of precision mattered less. You have one type of solution, then you kind of one type of diagnostic decision. But now more therapies like GLP-1, hypoglossal nerve stimulation, or appliance, and also pharmaceuticals that are coming, therapies become more mechanism specific, and the diagnostic data must be richer and more insightful. Multi-night testing with airflow and direct respiratory effort signals can really capture this level of granularity that physicians need, and also support endotyping and much more precise and personalized therapy for the patient.
A recent announcement from ResMed and Aura, they have a partnership now where they direct Aura members with flagged nighttime breathing disturbances toward ResMed educational resources, a sleep assessment, and the option to connect with an independent healthcare professional quickly. What's your reaction to this?
I think it's a very positive news for the field. Wearables like Aura have a very positive impact on sleep health awareness, and routing patients that are flagged for potential breathing disturbances toward a sleep assessment is definitely a step in the right direction. When we started working on Wesper, awareness was a big issue and a big topic. Now awareness is growing, is improving, and the connection between the awareness side and the medical side is strengthening with this partnership. And one thing to know, that while a wearable can tell you that something is off with your sleep, you tried sleep hygiene trick, you tried different solution that don't work for you, then a clinical analysis by a physician is required to determine the root cause of your poor sleep quality. So definitely a step in the right direction.
I don't know how many users there are of Aura Ring. I know they just came out with their fifth, and this with the Aura 5. And actually, that's the thing that's kind of held me back. I know it's a great product, and everyone who has one loves one. It was always the thickness of it that kind of drove me kind of crazy about it. Like I thought, oh, that thing's just too thick. But apparently, the new one is much thinner, and it is. I mean, this is great for sleep patients. You can look at it one way. Oh, ResMed just wants to drive more people to them, but that's true, right? That's the business they're in, but it's also they want to help patients. I mean, that's really the bottom line. And for a lot of people who may have an Oura ring who think maybe their sleep is a little wonky or not quite right, they may, they'll get that information that says, hey, and maybe the light bulb will go on because people are resistant, and maybe they'll get the help that they need. I think it's a great opportunity for everybody. And you're right. You had mentioned that all boats will rise, that the tide will lift all boats. And I think that is an important thing. For sleep professionals listening and watching, what's next for Wesper and what are the key takeaways?
First of all, we're living in a very exciting times right now in sleep health as a whole, both from the awareness side all the way to the medical side. Important to remember that wearables are bringing more people to the door, and the treatment menu has never been broader. Wearables also bring an opportunity to the medical field to gain insights to patients' habits, such as exercise or even nutrition, that might impact the overall assessment of sleep. So when professionals are analyzing a patient's sleep, they can actually benefit from this broader context that they never had access to before. However, what we deal with in the medical domain, that this is the still diagnostic step, is still a bottleneck, and Wesper is really built exactly for that moment. We are providing a clinical grade home testing with 15 channels, direct respiratory effort, and multi-night capability, and also direct to patient drop sheet model that completely unlocks providers' potential and clinicians' scale without adding any operational burden. I think this is critical for the field, especially as now awareness will grow. You need much more scalable solution, and Wesper is positioned exactly there.
It's great to see advances like this in the sleep field, and they can actually see them in person in Baltimore. Wesper will be at booth 1007. Your
Right.
whole crew will be there. And anything else happening at the booth that we should know about?
We're going to have some very exciting announcement, and our team will be there. We're really looking towards the conversations about the increased awareness and treatment option, and how Wesper can play a big role in providers' capacity and ability to deal better with sleep issues and outcomes. So really looking forward to see everyone there. Thank you,
Good.
Michael.
I'm going to stop by Amir Reuveny, CEO and founder of Wesper. Thanks for being here.
Thank you so much, Michael. It was a pleasure.